Okay, so we're covering the scapula today, and I want you guys to remember that the first thing you do whenever you're identifying a bone, especially one that's paired, you need to tell me if it's left or right, right? You always need to figure out, since it's paired, there's two of them, you got to tell specifically which bone it is. All right, and so we're going to try to figure out which left or right scapula this is. And the way you figure it out, I'm going to tell you two features right off the bat. This right here is called the glenoid cavity, right? And so this is where the head of the humerus fits into. And glenoid literally means socket. All right, so this is your shoulder socket. So that's going to needs to face the humerus, so that's going to face lateral. The other structure we like to use, it's called the scapular spine, or the spinous scapula. That's going to be posterior, right? So this face is posterior, the glenoid cavity faces lateral. I set those two features in those positions, and I know that is a left scapula. Okay? We're going to work our way through. There's about 14 features on here they want you to know, and it's not as bad as it seems because we're going to group most of those into categories. All right, so we already talked about the glenoid cavity. These two things are called processes. Right? A process is just a projection or something that sticks out. The one in the front is called the coracoid process. The root cora means crow in Latin. The crow family is called corvids. Right? So you'll see that pop up, that root. Anything that's kind of like looks like a beak is probably going to be called the root of cora. The one in the back is called the acromion process. Acromion comes from the root of acro, or like acrophobia, which means fear of heights. Acromion is the highest point on the scapula, right? So if you look at it from the side, you can see that the acromion process is higher than the coracoid. It's actually higher than all other parts on the scapula. All right, so you have the acromion process, the coracoid process, the glenoid cavity. You have the suprascapular notch right here. Right, so supra means above, scapular means scapula, notch means a little notch, and that's it, right? So we've already talked about the spine of the scapula, and we're going to talk about three fossas. A fossa is just a depression. So the first depression we're going to talk about is the subscapular fossa. So sub, like submarine, means below, and so subscapular fossa is underneath the scapula. Infraspinous fossa. Infraspinous fossa is going to be infra means below. Spinous references the spine of the scapula, and the fossa is the depression. So you see the infraspinous fossa there. And then the last one right up here is the supraspinous fossa. Right. So you have the supraspinous fossa, the infraspinous fossa, and then the subscapular fossa. And we'll get into those when we talked about muscles and shoulders. Shoulder muscles, but there's names that the supraspinatus, you're going to be able to figure that out, that that's the muscle that goes in the supraspinous fossa. All right, so those are the three fossas, which means depression. Then you have the lateral angle, superior angle, and inferior angle. Right, it's pretty straightforward. Lateral angle, superior angle, inferior angle. And you have a couple borders. You have a medial border, you have a superior border, and you have a lateral border. And that's it. That's all you need to know on the scapula. There's 14 structures there, but a lot of them can be categorized into a lot easier, to make it a lot easier to remember.